Hello again, this is Dr. Ryan Bell with YADAYADA Pediatrics. Let's spend a little bit of time talking about Osgood-Schlatter disease and Sever's disease. Osgood-Schlatter is a common cause of knee pain in a growing kid. It tends to be right at the point that the patellar tendon from the kneecap attaches to the top part of your leg. We call that the tibial tuberosity. You'll notice a lump right in that area that tends to be painful. It tends to be sore to push on it, and it can be pretty obvious as your child's going through those growing years, generally 5 to about 15 years old, for that area to become very sore and tender, especially if your child is an athlete and doing a lot of repetitive movements, jumping, running, standing, bending. Osgood-Schlatter disease is something that usually resolves on its own with time. Your child's okay to continue to play through the discomfort if they want to. It's not going to be damaging or harmful to that area. It's just going to be painful. If they can't rest a whole lot, can continue to stay flared up and have a hard time healing. A few things that we can look at treatment-wise would be to ice that area after activities or whenever it's hurting. Another common way to treat either of these problems would be to stretch. We like to stretch and kind of help those areas get to be a little more elastic. We also like doing exercises that will strengthen some of the muscles, especially strengthening your quads up in your thighs can be helpful in alleviating some of the symptoms of Osgood-Schlatter disease. A physical therapist may be helpful if your child needs work on stretching and strengthening, some of those things that you can work on at home if this is an ongoing problem. Can wear knee pads, especially if your child's involved in an activity or a sport where they tend to bump that area of the knee. That can be really painful. There are bands that you can use that put a little bit of pressure on that patellar tendon that kind of takes some of the pressure off of that area at the top of the tibia. Those patellar tendon bands can be very helpful. We can have a similar process that happens at the ankle, the area where the Achilles tendon attaches to the bone in the foot. That area can get a painful nodule that you push on it and it's sore and tender, and it's the same type of process. Treatment would be similar. You can do a small heel pad underneath the heel inside the shoe to give that area a little bit more of a stretch and of a cushion. But the same things apply to ice it, to rest it, to look for some type of brace or band that can take some pressure off of that area. And probably the most helpful and useful thing is doing some ibuprofen. So those things often get kids through those stretches of weeks or months or years where they tend to struggle with that pain and tenderness. There are rare cases where a case is bad enough that they end up needing surgery. Sometimes we will refer to a specialist, to an orthopedic surgeon that can take a look at it. Those cases are few and far between, especially when we look at how many kids struggle. The reason that we struggle so much in these two areas is that those are areas during growth where those bones are changing. As those bones are changing and growing, that bone is softer than times when you're not growing. The bone tends to be harder, a little more stable. And you've got those big tendons and those big muscles that are contracting and pulling and tugging on those tendons. And it puts a lot of pressure on the bone. And so growing bone tends to get inflammation and to be painful. So Osgood-Schlatter disease, kind of below the kneecap, or Sever's disease at the back of the heel, tend to resolve once your child is done growing and that bone gets a chance to harden up and be a little more stable. So those would be the main considerations with these two common pediatric ailments. Thanks.